Hi, and welcome back to the GI sections in which we're now going to go over anatomy. Let's first go over the retroperitoneal structures. What are the retroperitoneal structures? Well, they are all the different structures located in the retroperitoneal space, or the space in the abdomen behind the peritoneum. The retroperitoneal structures can be remembered by the mnemonic SAD pucker. The S stands for the suprarenal or adrenal glands. The A is for the aorta and the IVC. D is for the duodenum, the second and the third parts. P is for the pancreas minus the tail. U is for the ureters. And C is for the descending and ascending colon. K is for the kidneys. E is for the esophagus, specifically the lower 2/3 of the esophagus. And finally, R is for the upper 2/3 of the rectum. Retroperitoneal structures are commonly tested on the boards by asking which structures are responsible for a patient's retroperitoneal hematomas. This is usually presented as a patient who has suffered abdominal and pelvic trauma, such as by a car accident. Let's go over now some of the important ligaments. The falciform ligament connects the liver to the anterior abdominal wall. And remembering back to embryology, what is the falciform ligament a derivative of? That's right, the falciform ligament is a derivative of the fetal umbilical vein, and it contains the ligamentum teres hepatis. The hepatoduodenal ligament contains the portal triad, which consists of the hepatic artery, the portal vein, and the common bile duct. The hepatoduodenal ligament connects the greater and the lesser sacs, which represent two subdivisions of the peritoneum, and is right next to the gastrohepatic ligament. In surgery, the Pringle maneuver is where you compress the hepatoduodenal ligament between your thumb and index finger, placed in the omental foramen to control bleeding. The gastrohepatic ligament connects the liver to the lesser curvature of the stomach, as the name suggests, and it also contains the gastric arteries. Other important ligaments are the gastrocolic, the gastrosplenic, and the splenorenal. These are important ones to learn. The gastrocolic contains the greater curvature and transverse colon, as well as the gastroepiploic arteries. The gastrosplenic contains the greater curvature of the stomach and the spleen, as well as the short gastrics and the left gastroepiploic vessels. The splenorenal ligament connects the spleen to the posterior abdominal wall, and this contains the splenic artery and vein, as well as the tail of the pancreas. This part of the anatomy can be particularly confusing, so it can be helpful to view a different perspective of their ligaments and the connections. Let's go over the picture here. Here we have the falciform ligament, which as you can see is attaching the liver to the abdominal wall. You can see here the gastrohepatic ligament, which connects the liver to the stomach. And these contain the gastric vessels, which are here. The hepatoduodenal ligament, which is, you can see here, as we discussed before, contains the proper hepatic artery, the common bile duct, and the portal vein. The gastrosplenic ligament, which you can see here, is connecting the stomach to the spleen. The final ligament to mention is the splenorenal ligament, which connects the spleen to the posterior abdominal wall, and it carries the splenic artery and vein. Let's do a quick flash quiz to reinforce what we just learned. The gastrohepatic ligament contains what structures? That's right, it's the gastric arteries. Let's now go over some of the digestive tract anatomy. There are three main layers of the gut wall: the submucosa, the muscularis externa, and the serosa. What's the innermost layer? Well, it's the mucosa. This contains the epithelial layer, which is for nutrient uptake into the lumen, and surrounding this is the lamina propria, which provides support, as well as the muscularis mucosa, which contributes to motility. Outside of the mucosa is the submucosa, a thick connective layer that includes the submucosal or Meissner nerve plexus. The Meissner nerve plexus is the part of the enteric nervous system responsible for controlling GI secretions. The next layer, the muscularis externa, contains the other parts of the enteric nervous system. This includes the myenteric plexus, also known as the Auerbach plexus. The myenteric plexus is responsible for controlling muscle movements of this layer. An important point that is commonly tested and that brings in the pathology of the GI system is that ulcers can extend from the submucosa, inner or outer muscular layer. Erosions, though, are in which layer only? That's right, erosions occur only in the mucosa. The fourth and outermost layer is the serosa. Also, you should be aware that the mesentery is present along most of the GI tract and is needed to fix the position of the intestinal loops and to anchor the intestine to the retroperitoneal. Different parts of the GI tract have different basal electric rhythms determining the frequency of the contractions. The stomach is slow with just 3 waves per minute. The duodenum, though, is quite vigorous at 12 waves per minute. The ileum is a bit less active with about 8 to 9 waves per minute. Okay, we're now going to travel down the GI tract from the esophagus to the colon and mention the histological highlights of each region. These are especially important as pathological processes change the normal histological features and are frequently tested. The esophagus is well known for its non-keratinized stratified squamous epithelium. Keep this in mind as we will talk shortly about Baird's esophagus and how the histology is altered by acid. Again, in this diagram of the histology, we can see the different layers. The stomach has prominent gastric glands, which you can see here. The stomach's body and fundus also have rugae, which are shallow pits and deep glands. The duodenum has villi and microvilli. What is the function of the villi and the microvilli? Well, these work to increase the absorptive surface area. The duodenum also has crypts of Leverkusen. You can see here in this picture the crypts in the lower third of the image, with the villi extending up above. Whereas the villi are involved in absorption, the crypt cells are involved in secretion, and the stem cells are also located in the base of the crypt. Brunner glands are also found in the duodenum. They secrete a mucus-rich alkaline secretion into the submucosa. Brunner glands are histologically very peculiar since they exist in the submucosa, unlike most glands which are found in the mucosal layer. You can see them here being pointed to in the picture. Let's next go to the jejunum. The jejunum has the largest number of goblet cells in the small intestine. It also has the same crypts of Leverkusen as well as the plicae circularis. What are the plicae circularis? Well, as their name suggests, they are circular folds of the mucosa and submucosa. You may also know them as the valves of Krukring. The proximal ileum also has these plicae circularis, and the entire ileum has more crypts as well as the unique Peyer patches. These are collections of immune cells similar to the lymph nodes in other parts of the body, which you can see here. Lastly, we'll mention the colon, which also has crypts and numerous goblet cells, but unlike all the other parts of the small intestine, it does not have villi.